Thank you.
Cool. I'm sure every single one of us in this room has had this experience, either ourselves as clinicians and patients or someone we know. You walk into the doctor's office with a problem, a symptom, high blood pressure, high blood sugar, maybe a bacterial infection, maybe signs of depression. And the doctor has a simple solution. They whip out their prescription pad, they write you the prescription. Actually, nowadays they type it in the computer, but it's much more dramatic to whip out the prescription pad and write the prescription and hand it to you. Problem solved. But what has that done for us in our healthcare? I mean, sure, for acute bacterial infections, for acute diseases, okay, that can do something. But for chronic diseases, what has it done for high blood pressure, high blood sugar, and depression? I'd argue absolutely nothing. And until we can start framing nutritional interventions like that prescription, we're likely not going to make any progress. And that's why I want to talk about ketosis as a medical intervention, specifically for blood sugar, for mental health, although there are many other reasons. And I'm going to make the case for why it is as good or better than traditional or contemporary medical interventions and better than that prescription. But until we start framing it like that prescription, we're likely not going to make any progress. Because our advice right now for lifestyle is eat less, avoid fat, move more. And everybody in this room knows how well that works, right? It doesn't. But also because it's not used as a prescription, nor should it, because it doesn't work like a prescription. And we're going to talk more about that. So therapeutic nutritional ketosis is not a diet. And the more we refer to it as a diet, I think the worse, the more harm we're doing in this whole movement of nutrition as health. And it's, on the one hand, a very simple concept, but on the other hand, kind of a difficult concept to get through to the medical community. So first, my disclosures. I don't have any financial support from any relevant medical, pharmacologic, or food industries. I am the director of Metabolic Mind, which is a nonprofit initiative of Bazooki Group, and I have a consultative medical practice at Low Carb Cardiologist. So here's the standard medical care. Standard medical care, a pill for every ill. Now, if you're lucky, when you get that prescription, you're told what it is, what the dose is, how often to take it, how long to take it, what you can expect to be the benefits, what you can expect to potentially be some of the side effects or adverse effects, how we're going to monitor you for both the adverse effects and the success, when your follow-up appointment is, and when your blood test is for reviewing whatever the case may be. That's how medicine, at least prescriptions, are now given. And the future of medicine doesn't look all that promising in terms of the use of lifestyle or medicine. I mean, we've probably all seen the news now. This injectable GLP-1 agonists are approved for adolescents who are battling with obesity or overweight. A lifetime of medications, because the studies show once you stop the medications, the weight comes right back on. But we're trying to put a Band-Aid on it now for kids rather than teach them how to eat, how to behave, how to live their life, because it's easier and we know how to give that prescription. And the prescription of eat less, avoid fat, move more does nothing about the dose, the duration, what you expect to benefit, what you expect might happen from adverse effects. I mean, when you tell somebody, when a doctor tells this advice, do they ever say, yeah, but you're going to be pretty hungry and you're going to have some cravings, so you better figure out how to deal with that? No, they just say, move on. And that doesn't help. And this is frequently what results. People think, okay, this is how I have to eat. And nobody can sustain this. And this is obviously a bit dramatic. But the worst part is when someone says, okay, instead of eating like this, I'll just eat a smaller amount of this. And that's reducing my calories, right? That's eating intuitively. That's all things in moderation, right? I'm just going to reduce my calories. But this is not a medical intervention. And what I'm talking about today is getting away from this concept of diet, of dieting, and instead talk about nutrition as a medical intervention. Because when your nutrition, it looks like this. This is a metabolic intervention that changes your physiology, changes your metabolism, changes your neurotransmitters, changes the fuel your body uses. Does the Mediterranean diet do that? Does reducing your calorie content by 300 calories do that? No. They do not fundamentally change your metabolism, but therapeutic nutritional ketosis does. It's a medical intervention that changes the way your body functions, changes the way your brain uses fuel, and it needs to be treated as such. That's why I love this new term. I know it's a mouthful, but therapeutic nutritional ketosis. It's a mouthful, and a keto diet is so much easier to say. But when you hear keto diet, so many people out, at least in the medical community, think of a fad weight loss diet. But therapeutic, nutritional, ketosis, it is medical therapy, it is nutrition, and your body is producing ketones. That's why I love this term, and I know it's not as catchy, but I hope to make it catchy. The more I say it, I hope people are going to catch on. And the question is, do we have evidence to support that this is a medical intervention that's as good or better than the drugs we use? And actually, as I was coming up with the slides, I thought, is this just like too basic for me to say? Is this just like so repetitive, telling people what they know already? And then I stopped and I thought, like, that's fantastic. Like, maybe it is. Maybe it is so basic and repetitive, but think about where we've come. And I'm going to provide a little perspective as I talk about this. So here's a meta-analysis, efficacy and safety of low and very low carbohydrate diets for type 2 diabetes remission. Systematic review and meta-analysis of published and unpublished randomized trial data. So these are randomized controlled trials about low-carb diets. And there are 23 trials with 1,300 participants. And what they found was, at 6 months, low-carb diets achieved higher rates of diabetes remission, hemoglobin A1C less than 6.5%, in 57% of the participants. Now, 31% in the controls did, which was pretty good. In meta-analysis, there were different controls, different interventions, but 57% had diabetes remission. So this is when I kind of got some perspective for myself, too, when I was thinking, is this too basic? Is this too repetitive? For me to think that talking about a study showing 57% of diabetes remission is too basic kind of blew my mind, because if you rewind 5 years or 10 years, diabetes remission, that term wasn't even in our lexicon. We didn't even really talk about that, certainly not in the medical community. And now to think that it's common knowledge is actually pretty exciting about how we got here, because diabetes remission just wasn't a thing. Certainly going through medical school, it wasn't a thing. Why? Because our drugs don't do it. Instead, it's a therapeutic nutritional intervention that can do it. And a lot of it started back with this publication in 2018 from our friends at Verta Health, the late wonderful Dr. Scher, Dr. Steve Finney, Dr. Jeff Volek. And what they showed at 1 year, they were, I know this is a lot of words and I apologize, but lowering hemoglobin A1C to less than 6.5% at 1 year, anywhere from like the 42 to 69% range, depending on if you're looking at intention to treat, those who followed it. But this was one of the first to show, look, with an only nutrition intervention, we can put diabetes into remission, type 2 diabetes. Then they came out with this 2-year data. And what they showed in the 2-year data, 53% reversal, 17% remission, meaning no medications at all in type 2 diabetes, with a medical intervention of nutritional ketosis. Not here's your diet, not eat less, move more, not, change the way you eat, but a purposeful therapeutic nutritional intervention. Oh, whoops, why is this a blank slide? Oh yeah, because this is all the drug trials that show greater than 50% remission in type 2 diabetes. That's all of them right there, right? And it's not to say that drugs can't improve blood sugar. Sure, I mean, they're designed to do that, but at what cost and at what future dependency on those medications? That's it. I mean, the drug trials don't do remission in that way, only a therapeutic nutritional intervention. So where else can therapeutic nutritional ketosis be beneficial? The brain. And I really like this slide of the brain because it sort of presents it like the stars, right? It's sort of mystical. It's sort of mysterious. Like when I look up the stars, I know they're pretty amazing, but I have no idea, like, what is a star really? How far is it? Why am I seeing the light? How long ago? What makes up the star? Like, I don't know, and I apologize if there are any astrologers out here, but to me, I actually want it to be mystical. If I knew the truth, I'd be like, okay, it's just like a bunch of explosions and light or whatever, but it's so exciting for it to be mystical. And actually, I think that's how a lot of doctors sort of think about the brain, where they're talking about a cardiologist, an endocrinologist, even some primary care doctors. So it's like the brain's up there, I'm just going to deal with my little silo. We'll let the brain doctors deal with that, because the brain's pretty cool. It does a lot of amazing things that we can't really understand, so let the brain doctors deal with that. But I like to quote Dr. Georgia Ede when she says, well, last time she checked, the brain was connected to the body, so maybe we should treat it as such. And she has a very good point. So we have to sort of break down this mystical nature of the brain and realize the brain and the body are connected. Insulin resistance in the body affects the brain. Fuel usage in the body affects the brain. And mental health is health. And I think if we asked most doctors if they believe this to be true, they'd say, yes, of course that's true. But then if you look at how they practice and how they approach their patients, and there's still this disconnect, because it's a bit of a black box. It's a bit of like looking at the stars. It's a bit of a mystery. And This slide, that epilepsy and mental illness both affect the brain. Well, that seems like a non sequitur, but the point is, we've known for over 100 years that nutritional ketosis improves epilepsy in kids. Refractory epilepsy, where the medications aren't working, you put them on a very strict nutritional ketosis intervention and their seizures resolve. In some cases, more than 50% resolution, in some cases, 100% resolution. Well, guess what? Your brain's not divided into seizure brain and mental health brains. It is all brain. And I like to talk sort of vaguely as brain health. And that's because the ketones, the brain likes ketones. All right, that's also sort of vague. What does that mean? Well, when your brain is running on ketones, and it'll never run 100% on ketones, evidence seems to suggest you can get up to maybe 70% of your brain running on ketones. That's a lot better for a brain that's sort of battling with insulin resistance, trying to use glucose, not having the right amount of insulin, the ability to take it into the cells and create energy. But ketones can bypass all that. And what happens when you can do that? Well, you can balance neurotransmitters. We think of a lot of drugs that are given to balance neurotransmitters. Well, this is a therapeutic nutritional intervention that can increase GABA and decrease glutamate. And that balance can reduce the hyperexcitability of neurons and brain cells. And that's part of the mechanisms of how it might benefit seizures. But again, if it's benefiting your brain for seizures, it's going to benefit your brain for all sorts of functions and actions. It can decrease neuroinflammation. Inflammation is sort of a hot topic, right? But we talk about inflammation in our bodies. How often do we hear about neuroinflammation? But yet that's something that's implicated as potentially causative for symptoms of mental illness, for seizures. A therapeutic ketogenic intervention can reduce it. It gives you a more efficient brain fuel source. Now, what does that mean, more efficient? Well, we can actually measure how much oxygen it takes to produce ATP, the unit of energy, from glucose and from ketones. And it's more efficient to use ketones to produce that ATP. And it's also more efficient because it doesn't depend on insulin. It doesn't depend on if you're insulin resistant. It can bypass that system. So it can provide a completely different fuel source for your brain. Excuse me. You can decrease brain insulin resistance. So again, if we talk about insulin resistance in the body, it exists in the brain. And ketones and nutritional ketosis can help reduce that. And it can improve mitochondrial energy production. Now we're going to hear from Dr. Chris Palmer a lot about mitochondria and the energy, the power producer of the cell, but so much more than that. And nutritional ketosis, among other metabolic interventions, can improve that. And actually, I have a funny story here. At least I think it's a funny story. But I have two boys. I've got a now 13-year-old and 10-year-old. And 3 years ago, when my 13-year-old was 10, I was helping him study for this science project or the science quiz that they had at school called Mission Innovation. And we were learning about the cells. We were learning about, endoplasmic reticulum and the nucleus and the cell membrane and the mitochondria. And of course, like probably most 10-year-olds is like, Dad, this is stupid. Why do I need to learn this? I'm never going to use this. And I got excited. I'm like, of course you need to use this. When I was in medical school and I was learning all the stuff and you got to learn how the cells work and how the bodies work. And he just rolled his eyes and kind of walked away. And it was didn't really work. Fast forward to just a couple months ago where my younger son's now 10 doing the same thing with him. And we're going over the Golgi bodies and the mitochondria. And he goes, Dad, why do I need to learn this? This is stupid. I said, hold on. Ran to my office, grabbed Chris's book, Brain Energy, and I'm like, this is why. Look at this book I'm reading. It's all about mitochondria and the mitochondrial health for mental illness. He still just rolled his eyes and didn't get it, but I felt good that I had something to show him why he needed to learn about mitochondria, thanks to Dr. Chris Palmer, which we're going to hear more about later. But long way of saying that this is a medical intervention that can improve our mitochondrial function down to the cellular level, and that's pretty powerful. And then there are other ways, right? The psychobiome, the connection between your microbiome and your brain, which we're learning so much about, and so many other effects. Now take a look at the list. Tell me one drug that can do that. Tell me 2 or 3 or 4 drugs in combination that can do that, right? Not very many, probably none. Probably that same slide I showed you about the drugs that put more than 50% diabetes remission. It doesn't exist. And any intervention that does this should be treated like a prescription, should be treated like a medical intervention. Does a Mediterranean diet do this? And Mediterranean diets can take lots of different forms, but a Mediterranean diet that has healthy whole grains, right? Does that do this? No. Does all things in moderation do this? No. Does reducing your calories by just 500 calories do all these effects? No, because those are diets. And what I'm talking about is a therapeutic medical intervention. And when it comes to understanding how this impacts the brain, we have so many growing numbers of case reports and clinical experience. And this is just one that I'm highlighting here, Matt Bazuki, who's been very open about his experience. Normal kid, normal quote unquote, going to college, living a normal life, and all of a sudden, before he knows it, he's actually manic and psychotic, in and out of mental institutions, psychiatric institutions, trying to get treatment, eventually homeless, living behind a dumpster, and with the most supporting and loving family trying to get him treatment, but he was never quite well. He would make little steps, but never quite well, until he found Dr. Chris Palmer and others who helped him start therapeutic nutritional ketosis. And now, as his mom, Jan Bazuki, likes to say, he has no stigma, zero stigma of mental illness, leading a complete normal life, as she likes to say, which when he was going through all this, she had given up all hope that he was ever going to be a, as she says, quote unquote, normal kid, normal person again. And now it's like he never had his mental illness, with therapeutic nutritional ketosis being one of the cornerstones of his therapy. And he's not the only example. I just use him because he is so open and vocal about it, but there are more and more. And Dr. Ian Campbell, who is a researcher in the UK and someone who lives with bipolar disorder, who is also very vocal about it, did this study, an online report, right? So it's not a randomized controlled trial. It's an online report of people who have experienced nutritional ketosis with bipolar disorder. And what they found was 85% of those responding on ketogenic diets reported a positive impact on mood stabilization. And there was mood stabilization or remission of symptoms were higher for ketogenic diets at 56% compared to other diets at 15%. And the reports of improvement lasted for months to years. And they also had fewer episodes of depression, improved clarity of thought and speech, increased energy, and weight loss. Now, if you show something like this at a scientific conference or a medical conference, they're going to be like, okay, that's an online survey. Clearly selection bias, no question about it. But here's the thing. When it comes to drugs, again, drugs and prescriptions, this would never happen because you can't access the drug until it's available by the FDA. So it goes first to a randomized controlled trial, is approved by the FDA, and then you can have it. And that's the mentality we're in. Until something has been rigorously evaluated by an RCT, it doesn't exist, and we shouldn't be trying it. But this is a nutrition intervention. Nobody can patent it. And so therefore, nobody's spending billions of dollars from a drug company to study it. So it has to start somewhere. So we start with case reports, clinical experience, online surveys. And this is the building block to what's coming next. And thanks in large part to the Bazuki Brain Research Fund, we're funding 5 pilot trials right now to look at it. So the science is coming. But the question is, what do we do in the interim? What do we do for the people who are living with mental illness, who are looking for treatment now? And the science does exist to some extent. So this was a review in 2021 looking at sort of the papers that are out there. There's a case study in schizophrenia. There's a clinical trial in narcolepsy. There's a case study in major depression, an observational study and a case study in bipolar disorder, an autism spectrum, anorexia, Alzheimer's. So the net is fairly wide. And this is why I said, remember, the brain doesn't exist in silos. It's the brain. And nutritional ketosis is good for the brain. It's not good for bipolar. It's not good for seizures. It's not good for ADHD. It's good for brain health, which could, and again, no treatment is universal, but could, in many of these cases, resolve symptoms and improve patients' lives. So this was in 2021. And now, since then, the field has grown even more. And one of the most important studies, I think, that we've seen recently is this one right here. The Ketogenic Diet for Refractory Mental Illness, a retrospective analysis of 31 inpatients. So this was Dr. Albert Denon in France with a couple of pretty familiar names up there to help him write it up, Dr. Eric Westman, Dr. Laura Saslow, and Dr. Georgia Eade. And what Dr. Denon did with this study was he took 31 of his patients, he's a psychiatrist in France, that he'd been working with for years, and they were refractory, meaning they weren't getting better. So what did he do? He decided to put them in an inpatient unit where he can control what they were eating, and he changed their nutrition to therapeutic nutritional ketosis. That was the only intervention. And here's what he found. So first I got to talk about my new favorite person, Dr. Adrian Sotomoda, who is So smart, so kind, so generous, and he let me use his slides. Anybody who lets me use their slides is like my new best friend. I like giving talks, I hate making slides. So he helped me with his slide. So there's a little sign of what he did there. He had 28 patients, because only 3 of the 31 couldn't adhere to the diet. And that right away in itself is pretty amazing, because people think, well, if you've got bipolar disorder or schizophrenia, how are you going to be able to adhere to a diet? Well, 28 of the 31 were able to stick with it. And you can see the results there. 43% achieved clinical remission. 43% achieved clinical remission. Now, remember when I said, remission of type 2 diabetes wasn't even in our lexicon 10 years ago? Well, I don't think it was in our lexicon maybe 1 or 2 years ago in terms of psychiatry. And as I've heard Dr. Chris Palmer and Dr. Georgia Eid say many times, this doesn't happen. With conventional medical treatment, you don't get remission of serious mental illness. But yet here, with this nutritional intervention, 43% achieved clinical remission. 100% improved their symptoms, and 64% were discharged on less medication. But here's the next thing. If we can get the slide back up on the screen, please. And there's a lot of words there, but the Hamilton Depression Rating Scale went from 25 to 7. Okay, what does that mean? Well, that's another one of these sort of black boxes that most people don't know about, these rating scales, and I certainly didn't know about it until I got involved in this field, these rating scales that are used in psychiatry, but I want you to remember that one. Hamilton Depression Rating Scale from 25 to 7, and on the very bottom there, the PANSS, the Positive and Negative Syndrome Scale, from 91 to 43. Okay, well, what does all that mean? Okay, here's the Hamilton Depression Score. So greater than 23 is considered severe depression, and 0 to 7 is normal. Well, remember what those scores were? From 25 to 7. So from an average of severe depression to an average of normal, with therapeutic nutritional ketosis being the only intervention. Now, obviously, that doesn't mean everybody had that progression, but that was the average progression with therapeutic nutritional ketosis. Now, this is another complicated slide, again, courtesy of my new best friend, Dr. Sotomoda. But if you look at the right side here, this is the study for nortriptyline, which is an antidepressant. And this is the study that helped to get FDA approval. And what you can see on that far right side is the scores, the Hamilton Depression score, started around, looks like 23, 24, and over the course of time with nortriptyline intervention, went to maybe like a 7 or 8. That sounds kind of familiar, doesn't it? Oh yeah, pretty much the same things that Dr. Danon said, but this is an FDA-approved drug. This was the study that helped to get FDA approval. And we just saw with therapeutic nutritional ketosis, very similar, if not exactly the same improvement in symptoms, from a 25 to a 7.7, almost exactly the same as an FDA-approved drug for the study that got it FDA approval. Okay, well, what about the positive and negative symptom score? So this is a study looking at olanzapine and risperidone, 2 antipsychotic medications. Do I have a pointer here? I don't know if I have a pointer, but look at the very bottom of the chart where it says total score, and it went from 95 to 47. Okay, and this is, again, FDA-approved medications, 95 to 47. And what we saw, what Dr. Danon saw, was 91 to 49. Oddly similar to an FDA-approved medication for schizophrenia. But they didn't use, Dr. Danon didn't use FDA-approved interventions and medications. He used therapeutic nutritional ketosis. And that's why I think we have to realize that this is a medical intervention on par, if not better than many of our contemporary medications. Doesn't mean it can be used instead of all medications, but certainly as either an adjunct to or alternative treatment to in some cases, it has the ability to transform the way our brains and our bodies function in a way that other dietary approaches do not, and therefore should be used as a medical therapeutic intervention. But just like any medication, we have to use it responsibly, and we have to talk about potential adverse effects, what we expect to see, and potential concerns. So when we're talking about, I'll get to this in a second, but when we're talking about type 2 diabetes, right, we obviously have to talk about lowering your blood sugar, lowering the medications that can interact with lowering your blood sugar. We have to talk about safety, right? When it comes to psychiatric symptoms or mental illness, we have to talk about sleep. Because some people who start therapeutic nutritional ketosis will see a decrease in their sleep because maybe they have more energy, or maybe, it's just the way sort of ketones sometimes work. Well, for someone who's prone to mania or prone to psychosis, that's kind of a big deal. So that's something we need to be prepared for. And this is why it's a medical intervention that you shouldn't just start on your own, or you shouldn't just, watch a YouTube video about and start. But working with your clinician, because maybe you're going to need some sleep medication. Maybe you're going to need an increase in your antipsychotic medication. Depends how stable you are. But that's part of the therapeutic prescription. The second is the keto flu. And keto flu, when you transition from burning carbs, or from burning glucose and carbs to burning ketones and fat, your body can feel kind of crummy for a couple weeks. And again, if you're prone to depression, if you're prone to mania or psychosis, that's kind of a big deal. So you need to be prepared for that. And that's why people like Dr. Georgia Ede would recommend slowly transitioning into nutritional ketosis. Again, part of the prescription. Not just change your diet, but here's the stepwise way to do it as a formal prescription to get you into therapeutic nutritional ketosis safely and effectively as a prescription. Another one is medication levels, and this is an interesting one. Medications like lithium, like Depakote. Changing your body's metabolism and physiology can change your medication levels. And doctors are frequently checking medication levels. But interestingly, that doesn't mean you have to change the dose of the medication, because frequently symptoms improve despite a decreasing level, which is evidence that when safely monitored, going slowly over time, you could reduce medications and have continued benefits. And another one is energy levels, similar to like keto flu. If you're prone to depression and have some decreased energy levels, you need to be prepared for that. If you're prone to mania and psychosis and have increased energy levels, you need to prepare for that. So this is all part of the prescription. And support. Again, here's where this is more difficult as a medical intervention and prescription. It's not take this pill, here you go. You have to change the entire way you eat. You have to clean out your cabinets. You're going to need support. This is where online support, where nutrition support, where groups and family support is so important. And that also should be part of the prescription. When you're giving a therapeutic intervention, if someone's not going to remember to take their medications, you want to enlist the family members to help them remember. Right? Okay, when you sit down to have breakfast with your child who needs a medication for some reason, make sure they're taking their medication. Same thing, enlist the family, enlist this person's community. And look for resources, selfless plug here. At Metabolic Mind, we're trying to provide those resources. We're creating videos. And one of the best things I heard as we started creating these videos was Jan Ellison-Bazooki, who is sort of the founder of Metabolic Mind. She said, this is the information I wanted when I was going through this with my son, Matt. This is the information that would have helped me. So that's what we're trying to provide. Because we know psychiatrists are not well trained at the moment to provide nutritional ketosis information. We know people living with mental illness may not know about this therapy. So we want to provide the resources to help them. And we want to promote other resources like Dr. Georgia Ede's CME training course. For any clinician who wants to learn more about this, absolutely check out her training course at Diagnosis Diet. Beth Zupek-Kanya and Denise Potter, their nutritional course for dietitians and for anybody to learn how to start therapeutic nutritional ketosis. Absolutely check out that training course. And so many other resources out there. They exist, and they can help us frame nutritional ketosis as a medical intervention. So when is a diet not a diet? A diet is not a diet when it changes your body's physiology, when it changes your metabolism, when it changes how your brain functions, and when it has therapeutic implications that are on par or better than FDA-approved drugs. But as long as we talk about this as a keto diet, as long as we talk about it as one thing, as a diet, we're not going to make inroads in the medical community. As we can start to change the conversation to a therapeutic medical intervention, whether it's for blood sugar, whether it's for brain function, mental illness, seizures, and so many other interventions, until we can start to train people to think of it as a medical intervention, to prescribe it as, here's how you do it, here's the support you need, here's how we're going to monitor you for improvements, for potential side effects, here's your follow-up appointment, here's your blood work appointment, and these are the potential pitfalls you can run into, and these are the ways you can respond to it. Until we can frame it like that, we're not going to make as much inroads into the medical community, and there's so much good that can be done by having this become first-line therapy or co-therapy for so many different medical complications and diseases and problems, that whipping out that prescription pad, that dramatic whip out of the prescription pad, is not as dramatic to talk about a diet, but that's the direction we need to be headed. So what I hope everybody can walk away from this talk as is a diet is not a diet when it changes our physiology, and that's why we should talk more about therapeutic nutritional ketosis. Thank you very much.